what's poppin'? It's your boy Julian here, Julian Cross. Don't be zooming in on me and stuff. All right, yeah. Are you too close? Get the back, boy. All right. So yeah, you know what's up? Crash course style. Julian Cross here. Be doing some Obamacare. You know what I mean? So the official name for Obamacare is actually Patient Protection Affordable Care Act. You know, or the PPACA. Or ACA, Affordable Care Act. And so the ACA was signed into law to reform the healthcare industry by President Barack Obama on March 23, 2010, and was upheld by the Supreme Court on June 28, 2012. Obama's goal is to give more Americans access to affordable quality health insurance and to reduce the growth in U.S. healthcare spending. The Affordable Care Act expands the affordability, quality, and availability of private and public insurance through customer protection, regulations, subsidies, taxes, insurance exchanges, and other reforms, you know? Okay, so, you know, Obamacare offers a number of new benefits, rights, and protections. You know, so we got the stopping of insurance companies from denying your coverage based on your health status, or like if you're on death row or something, they can't deny you health insurance, you know? Stopping insurance companies from dropping you when you're sick or you made an honest mistake on your application. Preventing gender discrimination of, like, if you're a girl, you can't get health insurance. Stopping insurance companies from unjustified rate hikes. Stay on the bottom so I can get on stage, right? Requiring large businesses to insure employees, right? Whew. Let's get a little windy out here, damn it. Now, before it was called Obamacare, we got Hillary Care in 1993, which she tried to do this, but yeah, Hillary being first lady, kind of like how Michelle, Barack's wife, Michelle, how she pushed for like that kids movement stuff. Like each of the first ladies have their big like thing, you know. So you got Hillary Care. She tried to push for universal health care through the federal government, but at the time it was a little too complicated. They didn't want all that power to be in the government, and they still don't. That's why it's kind of like a debatable thing. So basically, if you can afford health insurance, but choose not to buy it, you must pay a fee called the individual shared responsibility payment, and that's sometimes called a penalty fine or individual mandate. So for 2015, the penalty for no health insurance is $325 per person, or 2% of your annual household income, whichever is higher. For 2016, the fee is $695, or 2.5% of your income, and they pick whichever one is higher. That's how they choose that. Some of the biggest misconceptions of Obamacare and the PPAC include only poor people can qualify for taxes. No, that's a myth. Under the ACA, the majority of those who get health care through the marketplace are eligible for tax credits, and that can make the plans more affordable. Myth. Now, say an average person is asking this question. My boss decreased my hours to avoid overpayment. No, the ACA provision that requires employees with 50 or more full-time equivalent employees to offer health benefits went into full effect in 2016. There was no worry that the employers would decrease employee hours to reduce the number of full-time employees and avoid having to pay full health benefits. Under the provisions, employees are considered full-time if they work 30 hours a week or more, right?
I mean, hell, these numbers shouldn't come as a surprise at all. Even the White House, in fact. The Washington Post reported in the morning that President Obama is set to begin an immediate public relations blitz aimed at turning around Americans' opinions on the healthcare bill, which is kind of crazy if you think about it. And short-term strategy to shore up political supporters of the legislation and long-term effort to bolster Obama's legacy. I mean, that's pretty cool. when the website crashed when users tried to sign up for the healthcare back in October 2013. This is a mad complaint amongst.
Yeah.
Obamacare.
So yeah. Right as soon as Obamacare came out, they had the website. You know, spent over like $600 million trying to get this website working and all that. You know, and just crashed. People couldn't what's good is the healthcare. If people can't even sign up for it on the website. You know. All right.
Well, anyway, some of the oppositions for Obamacare were the federal government is trying to take too much power away from the government.
Yeah, so that's a side for the Republicans. The Republicans think that the healthcare is the affordable, and they think that's too much power for the government, and that should be up for state and local authority for them to decide if healthcare.
Why, yes, you're right there, Julian.
Damn straight.
As the years pass, many people are becoming concerned that due to the high payouts following all the previous uninsured Americans now being insured, that this cost will be rising over time, like past 2016, 2017, 2018, so on and so forth. But that's not going to happen anymore because, well, Trump care is now in effect. But some critics believe that the ACA has made healthcare less attainable for the middle class, which you can argue both sides on, but I'd say it's a little more affordable for people lower middle class like me.
You know, like you got Hillary Care, like they just name it after each other. That's what they call it. So you got Hillary Care, Obamacare. Now Trump's president. He doesn't want to get rid of it. He wants to tweak some things on it. And they're calling it Trump Care.
It's a lot like Obamacare in a lot of ways. People are actually calling it just Obamacare, but in Trump's presidency.
All right, let's wrap it up. End that video.
All right,
Luther.
What?
You ready?
It's up. There's one countdown.
Okay, no, it's already going. All right. So the mystery document. So it told Republican senators that the bill passed by the House to repeal and replace Obamacare is quote-unquote mean. Another GOP source with direct knowledge of the meeting told that the group of 15 Republicans should build a more generous version of the American Health Care Act. Now, who wrote that? Who said all that stuff?
I was going in third person.
Isaac?
Wrong or right?
That's wrong.
Alright, what is it?
You gotta guess the name.
Julian, I'm gonna beat your swear to God if we don't get it.
So the mystery document was Donald Trump. Luther, how's that face feeling?
Good, because you made it incredibly freaking vague. God.
Donald Trump, mystery document. Bam. You're about to be in this video, bro.
Yeah.
What do you guys say? What do you guys say about Obamacare?
About what? Obamacare?
Bro, I'm putting that on, bro. Yep, too late.
I know. It's still filming.
All right, yeah. Go about Trump care.
Do you know where my?
Yeah.
You do? No, you don't.
They're filming up in the upper den.
Okay. Yeah, they're up in the upper den.
Oh yeah.
Hey, that's a co-producer Wyatt right there. Round of applause.
All right.
Anyway, on from that tangent, some of the opposers to Obamacare were two big factors: Trump care and some of the Republicans that opposed Obamacare back when it first came out. You know, 59% of people actually opposed Obamacare in 2010. I think 55% of those being Republican.
Okay, talk about Trump care.
I know. This has been Crash Course Obamacare. Hope you enjoyed your stay. If you want, leave a like down below and have fun.
Alright, yo, it's good. This has been a presentation brought to you by Julian and Luther, your fellow classmates. Some of the sources that we got include some page called like aboutobamacare.com or something like that. The actual website they use to sign up for Obamacare. And don't worry, Miss Shares, I'll like share a document of all that junk. But like, I don't know, it said on like the rubric or something, you know, right there. They actually need to like include the sources and the credits or something. And I'm editing this shiz on my phone. I don't know how to do the credits. So yeah, so you know what? Oh, would you look at that? Got it done. Can you read that? It says, I'll take the A. Thank you.